From past to present, Latinos in medicine have been influential in San Antonio. In just a moment, we'll meet Dr. Ray Altamirano, who brings his calling to those in need. But first, he's perhaps best known for Miraflores, the once spectacular garden he created along Hildebrand. Dr. Aurelio Urrutia was a respected physician and civic leader in the early 1900s. His great-granddaughter, Elise Urrutia, says he had fled to San Antonio to escape the political violence of the Mexican Revolution.
He was already a very successful physician from Mexico City before he came to the United States in 1914. He was the director of both the Escuela Nacional de Medicina and the Hospital General in Mexico City, which were the two highest medical institutions in the land at that time. He also had his own hospital, which he built, called Sanatorio Urrutia in Coyoacan, a suburb of Mexico City, which was on 25 acres. He was already doing a lot before he came to the United States. He served as essentially the Minister of Interior to President Victoriano Huerta, a not very well-liked president of Mexico, and he resigned after less than 3 months and wound up needing to leave Mexico because he was being pursued not only by President Huerta for his anger at Urrutia's resignation, but also by the forces on the left. So he was being pursued by both sides on his way out. He had 12 children in Mexico, he and his wife, Luz Fernandez. They left Mexico City with 6 of their children in May of 1914, just as the United States was coming in to occupy Veracruz. He escaped to Veracruz and was escorted by United States troops on a U.S. Army ship where they were the only passengers, taken to Galveston by the United States. So it really was the United States that saved their lives. They left 6 other children in Mexico. When they left Mexico, those children were brought out within the next 2 years. Of course, San Antonio was such an important town at that time with regard to Mexico and with regard to the Mexican Revolution. Both people who were anti-government and people who were pro-government used San Antonio as a place to gather, so it was a natural place for him to come. His first practice was where the San Antonio Light Building now stands. In 1926, he built a clínica and a farmacia. He often performed surgeries for people whom no other doctor would perform surgeries.
As a pioneering surgeon in 1917, Dr. Urrutia's great-granddaughter says he was the first surgeon to separate conjoined twins.
This was one of those instances where the family had gone from surgeon to surgeon, exploring what they could possibly do for these 5-year-old twins. I would say that one of his major accomplishments was serving as a doctor to many thousands of people on the west side of San Antonio. And he was always a physician who worked regardless of people's ability to pay. He was involved in forming groups to help alleviate unemployment, forming groups to support medical needs of poor people.
Dr. Urrutia's legacy lives on among those trying to ease the persistent health disparities confronting San Antonio's underserved communities. Many physicians are specialists in their fields. Dr. Ray Altamirano's specialty, he considers himself an expert in cost-conscious medicine, putting his patients ahead of profit. Born on San Antonio's south side with his mother's eyes, Dr. Ray Altamirano's mom had high expectations for her little boy.
School was always first, grades are always first. If school and grades are good, life was good.
Yet long before he was valedictorian at Harlandale High School, his mother had been shot in a holdup. Thankfully, she survived.
I was a kid, 11, 12 years old, who could have lost my mom but didn't, and I owed it to somebody.
Altamirano became a physician, like the one who'd saved his mother's life years earlier. But rather than practice anywhere else,
I found that when I was around people I felt like were like me, I had the same language as me, same likes as me. I felt there was just an immediate respect that they gave me because of the profession I had. And that was something that I hold very near and dear and wanted to build on.
he chose the community where he grew up. Practicing in urgent care clinics on the South Side is his day job, but Casa Salud, a clinic for the uninsured, is his calling.
When I started this practice, I only started opening on Sundays, and I would charge $100, and it would include blood work. I was able to negotiate prices for labs. I knew that with this margin, there's not much for me left, but that's not why I created this. My clinic is a part-time clinic because I'm only there when I can be, because we break even, right? We're not really a business. I call us more of a service than a business, but these ERs are higher yield where I could sustain it. This job subsidizes the job I really love, which is my clinic.
Painting is Altamirano's other love he developed later in life, along with his philosophy. Amor es vivir. To love is to live.
That's how I sign my paintings, but that's a motto of life, not just my art. I was very flattered when someone wanted it and liked it, and I have sold some. But I realized that selling some of these prints of what I do, if I could do this to help pay for patients that can't afford it, then wonderful. And I've never thought of myself or pictured myself as being an artist. I had to call myself that, right? Even though I never had formal training, I never did it as a kid. But I felt this gift came to me after some things happened in my life, and I can't explain it, and I don't think I even want to explain it.
For American Historia, I'm Jesse Degollado.